Inclusion is incorporating children who have special needs and those typically developing children into the same classroom that is developmentally appropriate for their age group. The goal is when you walk into a classroom, you don't notice children who have special needs versus those who do not have special needs unless it's some medical feature that kind of pinpoints them. Other than that, you just see a group of kids learning and flourishing together. Inclusion can start as early as 6 weeks old and carry kids all the way through college and after. The population of students that I work with are 6 weeks to 5 years old. Early intervention is so important for children with special needs because able to pinpoint those needs early and what works for them. So once they leave the program, they're able to, kind of assimilate into the other worlds of public school or private school, wherever they go for kindergarten through elementary school. But we definitely want to make sure that it's a flat line of what expectations are, and every child's levels are different, and so making sure that we know that individual child and that individual family's needs is important. Every child with special needs is different, and every parent's expectations and levels of acceptance are different. So of course it goes per the parent and the family and their needs, but we definitely explain to those parents, we're here to help your child specifically, and there's specific goals that we need to work on, and we want them to feel comfortable, we want them to feel safe, and we want them to feel included. And so whatever we need to do in the classroom to make that happen is definitely what we're striving for. But again, those goals that we're taking from their individualized education plans, we're incorporating those into the classroom as a larger group, so they're not singled out, and so the teachers aren't specifically pinpointing that specific child at a certain time of the day, but incorporating all of those goals into the daily routine of the classroom. When we talk about parents of older children, we definitely want them to know that having a strong team put together that is specifically there for your child, making sure you have your advocates, making sure you have people who understand and know your children, making sure that the therapists are on board with what the next accomplishments need to be, and continuing to push your child to be their very best and to strive more. Kind of once you go to elementary and middle school, a lull kind of happens, and you don't want that lull to take place. You always have to be the first advocate for your child and knowing what their needs are. So continuing to push, being present for every single individualized education plan meeting, making sure that you're communicating with the teachers. Communication is so important. This is your baby, this is your child, and you want them to have the best possible care and the best possible education. Research is so important. Making sure that you're asking the right questions when you go to certain childcare facilities or elementary schools. Making sure you understand what inclusion is and how your child will be incorporated. I would suggest having a list of questions ready to go, so when you walk in, you know what to expect and what to expect from that program for your child. First and foremost, they should be able to tell you with a clear voice what inclusion is and how your child will be incorporated into that program. Knowing the curriculum and how the curriculum will be set forth for your child is important. Also, how your child's individualized education plan goals will be incorporated into the daily classroom schedule. And also, it's important to know how the teachers communicate to the typically developing children about children in their classroom who have special needs, because making sure that your students are able to be tolerant and caring and loving to other students is super important. And if that communication isn't happening from the teachers in the classroom with the children, then it's kind of a fault for your child going into that program. Bottom line is making sure that children who are participating in inclusion programs or thinking about participating in inclusion programs understand that tolerance and acceptance is so important, and making sure that that message is communicated in the classroom with the teachers as well as being communicated at home, so those parents can model and set forth those same types of relationships.